Thanks, Dr. Anand, for joining us today. It is, and we really, really appreciate that you've taken out time to talk to us. Tell us, what time is it for you?
Hi, Shraddha. Thank you so much for having me. First of all, so appreciate the Your Story Forum to increase awareness around some of the major issues India is having currently with the COVID pandemic. So currently I'm in US in California. Currently it's 7 p.m. in the evening on Saturday. So
What is this viral load, and why is it that some people are having more of it and some are having less? What does that mean?
as you know, as the virus, whether it's mRNA or a DNA virus, go- goes through the submucosa, gets in the system. The first aspect is what is the initiating, how much is that contaminant load of on the person. So certain people who are in healthcare, definitely they're exposed to higher load of virus, and once it gets in the body, the immunity for everybody is a little different. People have, as you can imagine, different disease condition which is impacting their ability to fight this virus, and which then translates into different amount of virus replication inside the body and leading to different virus load. The virus load factor was very studied during the AIDS period, and similarly the same concept has come into the COVID. And the high virus load is typically associated with higher pathogenesis and more serious infection. That's the usual correlation. And there are multiple factors which count from the starting of the infection, how much virus load did you get in, and then within the body, how the virus is replicating and how the immune system is fighting the virus.
We are seeing very young people without any comorbidities condition. Actually, some of them are dying. So why is that happening?
And Shraddha, as you know, learning from the experience of Spanish flu, with each mutation, the virulence level changes. It can change. And initially, when the COVID-19 in the early form of mutation definitely was affecting more people with comorbidities, but we are seeing it affect now, since it seems like the viral virulence has increased and the pathogenesis is basically discarding the body's immunity in with the current mutation form, and seems to be that it is affecting people of young age without comorbidities now.
And then that brings me to the question is that why is the mutation happening so fast?
And this, as you know, this virus is very contagious. The R factor with the mutation has also changed and increased. So from each infected person, the amount of contagion it can spread is much higher. And that there are two types of shifts which happen without going into detail: antigenic drift and shift. And the more times the virus gets the opportunity to go within the population, there are more higher chances of mutation happening. It's just a random, just imagine if an event is happening more, the chances of those random mutations are higher.
I want to ask you, doctor, you're based in US, and we are seeing that US is now, people are going out, things have improved. What are some of the things we as a country, India, needs to do right now?
And Shraddha, that's a excellent question. And what I feel is it comes from couple levels. One is at the individual and family level, what we can do. One comes at a local administration level, what needs to be done. And third comes from the at a higher level, what needs to be done. At an individual level, what we need to be doing is at this time complying with the local authorities' guidance and using safe precautions. So some of the common things which have really worked in just sharing the US experience. As you know, Arizona at one point was one of the hottest bed for COVID with highest per capita infection rate. And what we did was basically we went into a lockdown. The citizens complied with that. We all stayed home, did not go out, did not interact with each other. People who are essential worker were given the proper PPEs, protection. And as we started opening, people were still using precautions like wearing face masks, very helpful, maintaining safe distance, washing your hands frequently if you need to go out. So some of these common safety precautions, which are so simple and still sometimes can be missed, is critical to emphasize and continuously needs to be told people that they need to wear masks. They need to, if they are going out, either use sanitizer or wash their hands frequently. And if they can avoid being out, avoid it. At a more what I'm seeing, feeling is definitely with this co with the current second wave in India, the the logistics and supply chain definitely in the healthcare needs to be improved, and this is a time for us as a in a country to rethink our supply chain and our healthcare, and we need to invest in healthcare infrastructure, build that, so that in future we are ready. Some of the key supplies like oxygen for hospitals were running out, and that's, I think it's more of a logistic and supply chain issue which happened in the situation, and we need to better manage that and have those plan of action and preparedness done, and have decentralized local preparedness center for disaster. Because one of the areas which we have worked in when I was in India, earthquake, some natural disaster, but similarly for the pandemic and infection, we need to have a better local action plan. And at a higher level, I think we need to be just like in US. Our experience was that we were not early enough to get to act in terms of closing the border, imposing lockdown, and starting messaging to people that to be safe. I think that's one of the most effective strategy. And I think at a higher level, we need to be carefully, continuously reminding people to stay safe and use precaution. And the last piece is the vaccination, which in US has been the big turnaround, and still it's an ongoing process. But we feel that by vaccinating the population at a larger scale, you are able to create immunity protection, which almost similar to herd. Once it get to the herd immunity standard, then the virus transfer and infection is better controlled.
We've been reading that Israel has come up with an antiviral drug. What do you think about antivirals, and what can India do right now?
And just sharing the experience which we had from our AIDS epidemic back in the day, we were having able to really develop antiviral which are very effective now and basically halt the replication of virus inside the body. And similarly, I know COVID has been 1 year, but I think there would be a very strong likelihood that we'll have several classes of antiviral working on different parts of the virus life cycle, which would be very effective against this. So I do see that again, Israel is doing this trial currently with this new antiviral. Similarly, we'll see 2, 3 other classes of antiviral come in play, which would be highly effective against slowing down the progression and the halting the viral load in this case.
We reading sometimes that you get vaccinated again, but still you get COVID, and then in 1 or 2 cases, people are also dying because of that. What do you have to say?
And again, we have to go back to common sense. Polio, if you remember, was a big epidemic affecting young kids. We in India launched a very effective polio immunization program, which almost led to the eradication of polio. Similarly, smallpox. So just going back, learning from the history that vaccines have been very effective in terms of controlling infectious disease. Similarly, coming to COVID, I think it's necessary. We have to have better communication and mass media and leadership from the communities come up to educate everyone that this is the way to go. While the vaccines have been very well tested and have gone through a rigorous clinical trial, much more than what we see, and have been proven to be safe. Like anything, there are some side effects in terms of local allergic reactions to people have been noted. So those things do happen and cannot be sidelined. At the same time, at a larger scale, they are very effective and will halt what we see in India. So I would highly encourage people to learn from past what we have been able to do to control epidemics. And similarly, I think this time everybody has to go and get a vaccination done. It's that'd be the recommendation. And based on US experience, definitely there are few side effects which have been noted, but on a larger scale, these vaccines are safe. And I personally have taken both doses and did have mild symptoms from the vaccine, but I would highly encourage everybody who has the opportunity to get this, because it's not just for them, but even people around them. And to stop this spread of the virus, we all need to do our part in by getting vaccinated.
Yeah. Want to understand on immunity, and what do you suggest we should do to increase our immunity at this time?
The common things which really help immunity is healthy diet, lifestyle, proper balance between activity, daily activity, nutritious diet. That's the key. In terms of going to the supplements, definitely the supplements taken within reason are supportive. There's no strong data to showcase that, or clinical trials to support that they halt progression or people from getting the infection. But truly, at a larger level, if you see there's no harm if the people are taking them within the directed daily consumption doses. And uh, and the big part would be just a active lifestyle, healthy body, healthy mind, which is gives a lot of immunity inside.
You have been very involved. You have contributed a lot in during this COVID time, and tell us about that. And more importantly, I want to ask you about your healthcare startup and what are you doing right now?
Shraddha, we all try to, in our small way, give back some of the learnings we have had in our life. And with the current pandemic, we felt that that definitely highlighted that virtual healthcare is a key way to deliver healthcare, to improve access to healthcare. Because you can imagine, in US we are seeing disparity in healthcare, difficulty of access to healthcare, and the only way you can improve and manage population effectively is by having a virtual strategy integrated with your overall healthcare continuum. And as part of that journey, I was I started a company called Acos MD, which created a virtual primary care solution. Because as you may know, that primary care infrastructure is lacking significantly, not only in India but also in US. And we feel that primary care is the gatekeeper to healthcare. And if you have a strong primary care that can focus on wellness, that can really reverse the disease cycle. And currently, all the focus is mostly towards secondary prevention. We need to start focusing on wellness and primary prevention. So ACOS MD focuses on virtual primary care, and it gives one-to-one relationship between patient and a provider, and also gives them a whole care team, and gives them a 360 approach from medical side, psychological side, co- general health coaching, which I think is very much needed by all of us.
Yeah, and are you operating that in India also?
So I started the initiative in US, was a very successful concept, and definitely coming with all my background in India and seeing the disparities in healthcare, felt that this was a much needed service in India as well. So we have launched ACOS India. And as part of that initiative, we felt that, especially in this time of COVID crisis, would be very useful to be allowed people to take consultation from home, because a lot of people may be having different questions, concerns. They may have some acute other issues related to their cardiovascular health, others other allergic issues, and just giving them an option or solution to be able to consult a physician is very helpful. So ACOS India has initiated an effort to provide teleconsultations across India currently.
Yeah, so today, if anyone watching, if they want to avail this consultation online, then they need to go to Acos Health India.
Yeah, and we'll be sharing on your Stoneer link where people can go and use a calendar link to make an appointment and consult with a physician.
If you had to, say some of the learnings from US, which India as a country, and then more so the government needs to implement right now, because we need right now a stronger intervention from the government. What would you say we need to do?
The key is at an individual level. I think the leadership is key in any situation like this. In a crisis, we need to have the leadership be upfront, get in front of things, and have a plan. So again, I'm pretty sure the Indian government would have a disaster preparedness group ready and reviewing the situation. But I think the messaging needs to be more frequent, more direct to people in terms of lockdown. I think that effort needs to be supported all across the country, because that's critical in terms of controlling the virus. There's a lot of support. We have been able to work with multiple organizations in India to be able to supply oxygen concentrator and other resources to the community. And we hope that one of the challenges which we felt was that a lot of the supplies were stuck at the airport, and were not able to get down. And definitely, like, the help of the Indian government would be very critical in terms of creating the logistic infrastructure to get this to the grassroots level, get the help much needed within the communities. And India is a large country with a large population, and definitely, but it also has an infrastructure around public health which is very deep rooted in grassroots. I think we need to get that activated. We need to create a start manufacturing. So as part of the emergency preparedness, we need to definitely have a plan of action to get vaccine prepared and get that distributed. At the same time, the supply chain issues around oxygen, remdesivir needs to be solved. And all that comes down to the policy at both federal level, which I say central government, as well as state level. Both need to work hand in hand. There shouldn't be a political issues. I think they should be above politics because people's life are at stake, and both the central government and state government need to join their efforts together to work with the local infrastructure and support them around healthcare needs.
Yeah, and I have to ask you this question is that we're seeing a lot of videos around yoga, breathing exercises. Some are talking about Ayurvedic medicine, homeopathy medicine. What would you say?
So I have a firm belief that active lifestyle, yoga, definitely builds your inner immunity. So activity, balance, good diet, nutrition, those things definitely have help. Supplements do not do harm. When it comes to some of the other alternate methods and some of the other formulations, there's not much data to back it up yet. And I have come across a few people who are exploiting this pandemic for their personal gains. And definitely, this is not time for that. The leadership at physicians in the communities need to take a leadership role and help guide people a little bit more in terms of what's valid and what's not valid. I think that's a dilemma and that's a misconception which gets promoted. And one of the challenges which we have is social media now. It's very hard to control misinformation, and that can spread very fast. And that's where I urge the local healthcare leadership to take a role to educate communities in terms of what works, what doesn't work. And the best thing is some common things, common sense things like wearing mask, not going out, avoid going out if you can, and frequent hand washing, sanitation. These are some common simple things which people can do to basically take care of themselves. And since you are indoor now, creating a daily exercise or something which meditation, yoga, whatever helps you to feel better, feel fit, should be the way to go.
When you take the vaccination, how long are you? How long do you have antibodies to fight the virus, or do you need to regularly take this vaccination?
So that's a $1 million question, Shraddha, which so a lot of these learnings will come. But based on just the influenza vaccine and the mutation which we are seeing, we think it's going to be probably an annual phenomenon where we'll need annual vaccination. And similar to in US, we get flu shot every year. And we feel, especially with this virus now being around and pandemic wise and with its mutation rate, probably it will become an annual vaccination. That's what I can guess at this time.
Thank you so much, Doctor. Thank you so much for talking to us today. This has been very, very helpful. And for everyone watching, I would say that go to Acos Health, right? Acos Health India for consultation.
Now, if there's any questions, any issue, I'll be happy to share my email. In any small way we can help the community, happy to do so. So we'll share the link for Acos MD. And again, as I said, best wishes to India from us. And we are with India and in fully support from US. And whatever we can do in our small way, we are there for you, India.
Thank you. Thank you so much, Doctor.